Our next speaker is Paul Billings. He's the National Senior Vice President of Public Policy for the American Lung Association. Paul oversees asthma, lung cancer, COPD, healthy air, to Hildy's point, and tobacco control advocacy program. I mean, like, isn't just lung cancer enough? I mean, this is a lot, but at any rate, that's what he oversees. And let's see, he has led federal advocacy campaigns resulting in stricter tobacco products regulations, improved patient access to preventive services, and cleanup of air pollution from motor vehicles and power plants. Paul has worked for the organization for more than 25 years, so he can give us a very good historic perspective. Previously, he directed grassroots activities for the National Clean Air Coalition and was an associate at the FMR Group in Washington, D.C. Paul, please come forward.
So I want to talk about two things today, collaboration and leverage. So first in the research space, a couple of years ago, longevity came to the Lung Association. We got together with Stand Up to Cancer, and we funded a lung cancer interception dream team with principal investigators at BU, Boston University, and UCLA. It led to collaborations with researchers at some of the other leading cancer research centers in the country at Stanford, Dartmouth, Roswell Park, Leahy, Johns Hopkins, Dana-Farber, and even University College in London. And now this collaboration is leveraging resources from Johnson & Johnson in the private sector and the National Cancer Institute. So it's really important to see that researchers can come together with funding from multiple groups, bring this group of experts together. This project is looking at developing diagnostic tools such as nasal swabs, blood tests, and radiological imaging for early detection of early-stage lung cancer. So we're very excited about that, and it's a great example of how organizations bring their dollars together and collaborate and leverage it. Today, we launched a lung cancer screening implementation guide. So this is an example of collaboration and leverage to reduce barriers. Partnering with the American Thoracic Society, bringing together a panel of 25 experts from 16 institutions, working to build this guide that will help community hospitals and community healthcare systems get lung cancer screening into places that lung cancer screening is not easily available and well understood, working to provide tools and resources to these health systems, to these hospitals, to be able to understand how to appropriately implement lung cancer screening and making sure that we can expand the availability of lung cancer screening to the places where it isn't, but it should be. Often these are the communities where we see the greatest burden of lung cancer. So we're very pleased to work with our partners at the American Thoracic Society and bring together this group of experts. Finally, I want to talk about collaboration and partnership with respect to awareness. Last year in 2017, we launched Save by the Scan, our lung cancer screening awareness campaign. We were building on the USPSTF recommendations and trying to drive demand from that high-risk population to talk to their doctors, talk to their healthcare providers about lung cancer screening. Well, how do we do that? Well, we need to make people aware that they are in that high-risk group. So working with the Ad Council, and that was our collaboration, which brings us together with all kinds of media outlets, television, radio, print, even though print's almost dead, online, working through Facebook, WebMD, USA Today, to put together this information to get people to understand that they are at risk. So in the first year of the campaign, and we're well into the second year now, more than 137,000 Americans took the Save by the Scan quiz, and 51,000 or more who completed the quiz met the criteria and were encouraged to speak to their doctor. So we're seeing that if we make people aware, they'll take the quiz, they'll find out that they are at high risk, and then they will see their healthcare provider about getting screened. And the work we're doing with the American Thoracic Society to help community hospitals and community health systems be able to provide that screening, we're creating the opportunity for the people to get the screening that they need. So I see that these all work together. And then, of course, the research project I started with, looking to develop new and better diagnostic tools to reach a broader population, to reach a different population, less invasive, lower cost. We heard about that in the previous panel. And then, Brie, how much time do I got left, Bob?
You've got a minute.
Okay. I'll just talk quickly about air pollution because it came up in the earlier panel. This week in Geneva, the World Health Organization hosted a conference on air pollution and health, and some very startling data came out of there. 9 in 10 people in the world are breathing polluted air. We're doing much better in the United States because thanks to the Clean Air Act, but still nearly half of us breathe polluted air on too many days of the year. We're seeing that 7 million people are dying annually globally from air pollution, 600,000 children. There's a lot of work to be done on air pollution, but it's an important part of this continuum of activity we need to do to advocate to reduce the burden of all lung disease. Certainly lung cancer is a prime health endpoint. And just one final point, there was a physician from India who showed that 30 years ago, 1 in 10 of his patients who had lung cancer were non-smokers. Today he's seeing 5 out of 10 because the air is so polluted in India. Think about that. 5 out of his 10 patients are non-smokers or being diagnosed with lung cancer in India. We've done a lot in this country. We have a lot more to do. I'm past my time, so I'm done. Thank you.